in terms of how does telehealth and physical therapy work, especially in a patient who may need some assistance? Do you have some sort of extender in the home still that's helping to do some of what you need with the patient?
Yeah, it's going to be different. I've benefited because I've been sort of doing this kind of, I guess, just with my family members whenever they have something or friends.
Yeah.
Skype or something like that. We've been doing this for the better part maybe of 10 years when I started PT school. Mm-hmm. You got to get used to giving people instructions and demonstrating things and realizing there's just some things you're not going to be able to do virtually. If someone needs, hands-on things, right? Maybe that's not the best platform. And maybe that's someone that would need to come into a clinic, like in a patient, acute stroke, that probably needs someone there to kind of guide them along. But most of our stuff regarding a variety of low back pain, or the patients I work with, we're seeing mainly for arthritis or just deconditioning, preparing them for their surgery. We can manage a lot of that from a telehealth platform. And it's been done for exercise training for years. There's a group in Falvey in Italy and Birmingham in the UK. They've been doing this for years for cardiac rehab. But the problem is with them, they would send the patient, an exercise bike, monitoring equipment. They'd send them the camera, send them the stuff, and there'd be things built in. So I think hopefully once this resolved, we'll look at doing that because, invariably this will happen again. We need to be prepared for it.
Need to be prepared.
Yeah.
So in terms of securing that personal protective equipment, are there any agencies or any NGOs or not-for-profits or anything that stepped up to help?
County, the Maryland Department of Health have actually supplied personal protective equipment to agencies and to individual residential service agencies for us to go out to provide care because it's needed. One of the issues is that everybody is actually trying to get the equipment. The hospitals,
right,
homes, home health agencies, and other agencies that just provide personal care and companionship to a lot of elderly residents in the state. So it's
a huge shortage.
Yeah, they're rationing a lot of stuff out, but we are getting stuff from the Maryland Department of Health.
Well, that's good. So Department of Health. How about you, Dr. Falvey, in New Haven? What's been your experience? And from your colleagues, what have you heard?
Yale has, been fortunate that they haven't had to ration equipment yet. I mean, we get updates every day from the university and from the hospital system, but we've run low on a substantial amount of gowns and N95 masks, and we've leveraged international connections that we have through the university with our study abroad partners in China and in South Korea. We've actually leveraged those kind of relationships to order and get personal protective equipment in, which is a challenge when other states are competing for that, other companies, and even the federal government is taking personal protective equipment at times and requisitioning or redirecting shipments into the national warehouse. So I think every community is stepping up. There's just not a massive coordinated effort. So, but we've had challenges for sure, and we've definitely, in some of the home care and long-term care organizations, have definitely had more of a grassroots effort. In home care, we are rationing some equipment and trying to be really conservative with the number of patient visits that we do, because home care agencies in particular run on a pretty small profit margin and just don't have the ability to have tons of equipment in the store.
Yet it's necessary equipment for a very necessary and essential service.
Yes, so that has been, I've been really concerned nationally how many facilities have defined physical therapy as non-essential. There's many assisted living facility communities, many long-term care facilities who have shut their doors to any non-essential medical personnel, and that has included physical therapists at times.
Wow.
So we've had a major advocacy effort on board. We've written a perspective piece in our journal to really lay out the case for that there are some patients for whom face-to-face therapy is necessary. and
Right.
for whom we really do need those pieces of equipment. Telehealth is a great option for many people, but for people who are cognitively impaired or perhaps don't have a caregiver in rural areas where broadband internet access isn't available, or for socioeconomically disadvantaged populations, or patients living in congregate living situations where telehealth just can't provide the kind of services and the kind of privacy that are necessary.